All right, let's talk about something that doesn't get discussed enough, but is incredibly important. Today's video is about 7 skin warning signs of pancreatic cancer that you should never ignore. Now, I want to be very clear from the start. Most skin changes are harmless and are not cancer, but pancreatic cancer is one of those conditions that often stays silent deep inside the body, and sometimes the skin is the first place it sends warning signals. In this video, I'll explain what pancreatic cancer is in simple terms, why it can affect the skin, the 7 skin signs you should watch for, how doctors diagnose it, and what treatment usually looks like. So yeah, let's get into it. First, what exactly is pancreatic cancer? The pancreas is an organ that sits deep in your upper abdomen, behind the stomach. It has 2 major jobs. One, it helps control blood sugar by releasing hormones like insulin. And 2, it helps digest food by releasing digestive enzymes into the gut. Pancreatic cancer happens when cells in this organ start growing out of control. The most common type starts in the ducts that carry digestive juices. The problem with pancreatic cancer is that it often doesn't cause pain or obvious symptoms early on. Because it's hidden so deep, people don't notice anything until later stages. That's why these skin signs are so important. Now let's quickly understand why the skin gets involved at all. When the pancreas isn't working properly, it affects bile flow, digestion, hormones, and even blood clotting. All of those changes can show up on the skin. Think of the skin as a warning screen on the outside of the body, showing internal problems. Let's go through the 7 skin warning signs, one by one. The first and most important sign is jaundice, which is yellowing of the skin and the whites of the eyes. This happens when a yellow pigment called bilirubin builds up in the blood. Normally, bile carries bilirubin out of the body, but a pancreatic tumor, especially in the head of the pancreas, can press on the bile duct and block it, like stepping on a hose. Bile backs up, bilirubin rises, and the skin turns yellow. Often, this jaundice is painless, which is a big red flag. Urine may turn dark, stools may become pale, and the skin may look dull or yellowish. Painless jaundice in an older adult equals pancreatic cancer until proven otherwise. The second sign is intense itching, also called pruritus. This isn't your usual dry skin itch. It can be deep, constant, and extremely uncomfortable. This happens because bile salts build up in the bloodstream and deposit in the skin, irritating nerve endings. Sometimes itching actually appears before visible jaundice, which makes it even more important to take seriously. The third skin warning sign is easy bruising or unexplained bleeding under the skin. People may notice frequent bruises, purple patches, or bleeding from minor bumps. This happens because bile is needed to absorb vitamin K, and vitamin K is essential for blood clotting. When bile flow is blocked, vitamin K levels drop and the blood doesn't clot properly. The fourth sign is something called migratory thrombophlebitis, also known as Trousseau syndrome. In simple terms, pancreatic cancer can make the blood unusually sticky. This leads to small blood clots, forming in veins just under the skin. You may see tender, red, cord-like veins that appear in one area, then disappear and show up somewhere else. That moving pattern is the key clue. This is a classic paraneoplastic sign, meaning it's an indirect effect of cancer. Migratory blood clots strongly point toward pancreatic cancer. The fifth sign is acanthosis nigricans, which looks like dark, thick, velvety skin, usually around the neck, armpits, or groin. Most of the time, this is linked to insulin resistance or obesity. But when it appears suddenly in an older adult, without weight gain or diabetes, it can signal an internal cancer, including pancreatic cancer. The cancer affects growth factors and insulin signaling, causing the skin to thicken and darken rapidly. The sixth sign is new-onset diabetes with skin changes. Because the pancreas controls insulin, cancer can disrupt blood sugar regulation. People may suddenly develop diabetes or notice their blood sugars getting worse. Skin clues include recurrent fungal infections, slow wound healing, very dry skin, and frequent skin infections. New diabetes in an older adult, especially with weight loss or jaundice, should always raise concern. Now here's the 7th and often overlooked skin warning sign: fatty skin deposits and yellowish bumps, called xanthomas. These are yellow or orange bumps that can appear on the eyelids, elbows, knees, or hands. They happen because bile blockage and pancreatic dysfunction can disrupt fat metabolism, leading to very high cholesterol levels in the blood. That excess fat gets deposited in the skin, while xanthomas are more commonly linked to lipid disorders. Their sudden appearance alongside jaundice or itching should raise suspicion for underlying pancreatic disease. Now let's briefly talk about diagnosis. If these signs raise concern, doctors usually start with blood tests, which may show elevated bilirubin, abnormal liver enzymes, and sometimes a tumor marker called CA19-9. Imaging is key. A CT scan with pancreatic protocol is often the first major test. MRI or specialized bile duct imaging may follow. Endoscopic ultrasound allows doctors to see the pancreas closely and take biopsies. Diagnosis is confirmed with tissue sampling. Treatment depends on how advanced the cancer is. If caught early, surgery may be possible, most commonly the Whipple procedure. Chemotherapy is often used before or after surgery. In advanced cases, treatment focuses on relieving symptoms, restoring bile flow with stents, managing pain, and improving quality of life. Skin symptoms like itching and jaundice often improve once bile flow is restored. Quick reminder here, if this video is helping you understand these signs better, make sure to like the video and subscribe. It really supports the channel and helps me keep making clear, practical medical content like this. Final takeaway. The skin can be an early warning system for serious internal disease. Sudden, unexplained skin changes should never be ignored. Whether you're a student or just looking out for your health, awareness matters. Thanks for watching, and I'll see you in the next video.